In the next 5 minutes, I'm just going to take you through an easy way of just doing a quick sort of quality check for your local site's data. One of the reasons for doing this is because you may well have realised that when you are faced with this record status dashboard here, whilst the green dot suggests that point of the data, that form within the data set, is complete, and the red dot that it's incomplete, actually this is ticking complete here is not conditional upon these data points actually being there. So if I delete this, save this, ignore the warning, and then go back into that patient, status dashboard, you'll see that there's still appearing green despite the fact that I've deleted that data point. So I'll just put that back in, and then head back to the data record status dashboard. So this overview isn't terribly helpful in terms of determining whether there is any missingness in your data set. And so one very easy way of doing that is through REDCap's own sort of statistics tool. So if you go over here to the left-hand side, Data Exports, Reports and Stats, you'll be faced with this screen. And if you click on Stats and Charts here, REDCap will produce a very nice summary of all of the data that you've put in for your data access group. So select the instrument, and that's the form. If we take the first one, demographics, and then below here it will have a summary of all of the data that you've included. So ignore the first data point, hospital site, because there will only be one or one data access group that you will have login rights for. So scroll down past that, and then when you get down here, if we take age as an example, you get a nice chart that just shows you the spread of your data. Up here it tells you if you have any missing data points, and one useful thing to do would be down here is just to make sure that you don't have any data points beyond this 15 years old mark, because actually we've had a few case records put in for patients who are 16, but they don't actually meet the inclusion criteria, so they would therefore have to be excluded and would need to be removed. If you go down to weight, again for this site there's no missing data, but it's quite nice to just have a quick look at the spread of the data and just eyeball it to determine if you think it's a true representation of your patient cohort. So if, as an example, there was a data point way out here that read 250 kilos, then you could click on it. So we'll pretend that's this one as an example, and it directly opens up that case record form, and you would be able to go into it and determine whether indeed that was a true value, or whether, going back to your paper chart or the patient records, whether the decimal point was in the wrong place. So it's just a very quick way of identifying anomalous results for your own cohort. Now you'll see here that height is missing, and that's because we stopped collecting that partway through the study because sites were struggling to access that information. Now if we move on to ethnicity as an example, you'll see here within this site we had one missing, and that's actually a child or parent who refused to disclose their ethnicity. But if you click on this just as an example, the one that is missing, it will tell you which case record it is, and again you could click on it, go into the case record, and indeed you can see here that it is missing, and then again you would know which patient, looking at your patient identifiable sheet record, you'd then be able to work out which patient that is, and go back to the notes if indeed you were able to fill that information in. There are some data points that will show as many missing just by virtue of them being conditional based on the previous question. So if, for instance, it said IV fluids administered and you had 10 patients for whom that were not the case, if the next question were at what time were these IV fluids administered, then it's likely that you will have 10 missing for that data point, and that's absolutely fine. One data point that I would really ask that people would check is this 6.19 down here. which is the Clavian Dindo grade that you're well aware is our primary outcome measure. Any that are missing here are very unlikely to be included in the final data set itself. So this is arguably the most important data point to ensure that we have complete data on. And so really, I just want to show you a very quick way of just whizzing through your data. I've done it for our local site, and it probably took me about between half an hour and an hour just to quickly run through and then go back and check on a couple of points within the actual patient notes. We very much appreciate the amount of time that you've taken to fill out these CRFs. I know they are quite arduous, but the quality of the data is really integral to the whole the study itself. So once again, thank you very much for your help. If you have any questions about how to use this REDCap data summary tool, just send us an email to the CASAP inbox, and we will endeavour to reply to you as quickly as possible, because we know that the deadline for submitting data is just around the corner. Thanks again.